Hello everyone. In this video, we will look at the difference between arterial ulcer and venous ulcer. And arterial ulcer is due to insufficiency in arterial blood flow, whereas a venous ulcer is due to venous hypertension and insufficiency. Arterial ulcers are usually located on the toes, the dorsum of the foot, and the lateral malleolus, whereas a venous ulcer is usually on medial malleolus and the gaiter area of the foot. An arterial ulcer appears small, deep, punched out with well defined edges, whereas a venous ulcer is large, shallow, with irregular edges. The surrounding skin in an arterial ulcer appears pale, dry, atrophic, shiny, with hairless skin. The skin surrounding a venous ulcer is eczematous, hyperpigmented, edematous, as well as may be associated with varicose veins. Arterial ulcers are very painful, whereas venous ulcers are associated with mild to moderate pain. There is a very small amount of discharge, if any, in arterial ulcers, whereas there is moderate to profuse discharge in venous ulcer. The edges in an arterial ulcer are well defined, whereas a venous ulcer edges are ill defined. The tendency for arterial ulcers to heal is poor, whereas the tendency of venous ulcer to heal is good, along with treatment, wound care, and compression. Distal pulses are reduced or absent in arterial ulcer. Distal pulses are usually normal in venous ulcer. Arterial ulcers are caused by conditions such as atherosclerosis, peripheral arterial diseases, smoking, as well as in diabetic patients. Venous ulcers are commonly caused by chronic venous insufficiency, varicose veins, DVT, as well as obesity. The treatment principle for arterial ulcer is to improve the blood flow by revascularization as well as wound care. Treatment principle in venous ulcer is by giving compression therapy, foot end elevation, and wound care. So, a quick memory trick to remember venous ulcer is it is associated with varicose veins. There is edematous skin surrounding. It is near the medial malleolus. There is oozing discharge. The ulcers are large and shallow, and the surrounding skin is pigmented. For an arterial ulcer, it is present anteriorly or on the dorsum. There is resting pain. The ulcer appears tiny and deep. The edges are well defined. There is reduced pulse. There is ischemia associated. The skin appears atrophic or pale, and it is associated with less discharge. Thank you. Follow for more.